Imagine it's 3 a.m. Your child has a fever of 103 degrees. The power has been out for 3 days. The local pharmacy has been boarded up since Tuesday. And when you pick up the phone to call for help, you get a busy signal.
Most people think survival is about finding water or building a fire. But in a real, long-term crisis, the thing that actually kills you isn't the lack of food. It's a $5 infection that you can't treat because the supply chain snapped.
Today, I'm going to show you 7 medical essentials that will be the first to vanish from shelves. These are the items that, true collapse, become more valuable than gold. They're often called black market essentials, but here's the secret. You can source almost all of them legally right now without a prescription if you know where to look. By the end of this video, you won't just have a list, you'll have a shadow pharmacy that could be the difference between a minor injury and a terminal one. Let's get into it. Number 1. The liquid stitch. We've all seen it in the movies. Someone gets a deep cut and they just pour some whiskey on it. In reality, that's a death sentence. When your skin is breached deeply, you have a 12-hour window before the risk of sepsis skyrockets. You aren't looking for band-aids, you're looking for medical-grade skin glue. On the black market, this is the same polymer used in human surgery. The legal source? You can find the exact chemical equivalent in high-purity veterinary glue. It closes a wound faster than any needle and thread. Just a warning, do not use industrial superglue from the hardware store. The chemicals can damage your tissue. You need the veterinary version. It's legal and it's shelf-stable for years.
Number 2. The primary defense. If I told you the most powerful antibiotic in the world was sitting in a jar on your counter, you'd probably roll your eyes. But during World War I, before penicillin existed, doctors used one specific substance to treat gangrene, medical-grade Manuka honey with a high UMF rating. This isn't the stuff in the plastic bear. It contains a compound that creates a literal bioshield that bacteria cannot become resistant to. It is the only antibiotic that never expires. If you have 5 pounds of this in your stash, you have a currency that people will trade almost anything for when the medicine runs out.
Number 3. The fish controversy. This is the one that gets people in trouble. Most people think oral antibiotics are 100% off limits without a doctor. For years, the survival community has whispered about fish mox or fish flex. These are the exact same pills produced in the same labs as human medication, just bottled for aquarium use. However, regulations are cracking down on these. The modern black market method is actually simpler. Use legal telehealth services like Jace Medical or Duration Health. These allow you to consult with a doctor now to get an emergency supply of antibiotics legally. Why wait for the riot to start to ask for a prescription?
Number 4. The silent lung saver. If there's a fire, a chemical spill, or a new respiratory outbreak, the first thing to disappear is the N95 mask. But there's something better that nobody is buying: nebulizer saline. In a disaster, the air isn't clean. If you can't breathe, you can't survive. You can buy sterile saline in bulk without a prescription. When used in a portable, battery-operated nebulizer, it can clear lungs of smoke and particulates that would otherwise lead to pneumonia. It's the ultimate survival tool for your respiratory system.
Number 5. The blood stopper. You have about 3 minutes to live if you nick a major artery. Most first aid kits have gauze, but gauze is useless for a major bleed. You need hemostatic agents like Quick Clot or Celox. These were once restricted to military medics. They use special minerals to trigger clotting in seconds. You can source the tactical version legally, but here's the insider tip. Look for the granules sold for farming and livestock. It's the same chemical, it's half the price, and it stops blood just as fast. Number 6. The painkiller. Pain isn't just uncomfortable, it's a survival hazard. It causes shock and stops you from thinking clearly. When the ibuprofen is gone, people will get desperate. I'm not talking about herbs, I'm talking about oil of cloves. In a crisis,
Dental emergencies are a leading cause of medical failure. An abscessed tooth can lead to a heart infection. This oil is a powerful anesthetic. 2 drops on a cotton ball will numb a toothache as effectively as a professional shot. It's an ancient remedy that actually outperforms modern meds for dental pain.
Number 7. The universal antidote. This final item is the most underrated tool in medical history. If someone swallows a toxin, eats tainted food, or gets a chemical burn, there is one substance that can save them: USP-grade activated charcoal. It doesn't just help an upset stomach, it absorbs toxins, preventing them from entering the bloodstream. In an emergency where you might be eating questionable food or drinking filtered, sketchy water, this is your internal filter. Buy the powder in bulk, it lasts forever, and can even be used to build an emergency water filter.
Having these 7 items doesn't make you a doctor. It makes you a survivor. The black market isn't a place. It's a mindset of being prepared before everyone else even realizes there's a problem. But gear is only half the battle. If you have the glue but don't know how to clean the wound, you've just sealed an infection inside. Which is why I've put together a specific procedure guide for using these items. Would you like me to walk through the 5-step infection protocol that military medics use when they're 50 miles from a hospital? Click here to watch that next, and I'll see you in the field.